Hello and welcome to Get Yourself Optimized. I'm your host, Stefan Spencer, and today I'm very excited and happy to have Dr. Barry Gillespie with us. Dr. Gillespie created, in fact, the Craniosacral Fascial System. And you're going to learn all about this. I've heard before of craniosacral therapy, but I had not, prior to a year ago, heard of CFT, which is Craniosacral Fascial Therapy. So you're going to learn about the distinctions. You're going to learn how it affects adults, children, and infants. The Gillespie approach is Dr. Gillespie's program and methodology, which is pretty amazing and has changed a lot of people's lives, especially babies. And the way it works is when physical and or emotional traumas adversely tighten the fascial system, this freely moving system, tremendous pressure can be exerted on associated nerves, muscles, organs, blood vessels, lymph vessels, and bones. And that can present itself then as health conditions as you grow older. So you're going to learn all about this, and we have the guy with us today, the creator of this whole approach, to talk to us about this amazing kind of technology. Dr. Gillespie, great to have you on the show.
Thank you for having me on the show.
So let's first of all talk about how did you get into this whole discipline of craniosacral fascial therapy? You weren't just kind of born into it. Somehow you had some defining events that brought you into this particular area of focus.
I did have a defining event. I graduated from my surgical residency in 1975, and then I opened my periodontal practice, and I thought life was very good until I started getting headaches. And they wouldn't go away, and I went to my medical friends, and they did a lot of conventional testing, and after a number of months, they threw their arms up and they said, we can't help you. It's probably the stress of opening a business, opening your practice. And that wasn't to be the case. And my head still hurt. And after a while, your friends can't help you in the medical model and your head hurts and you start to look in the alternative world, which I had no clue. And I heard about this thing called cranial sacral. And when I heard about it, I thought it was witchcraft. I thought it was voodoo. I thought it wasn't going to work. It was going to be a waste of time and everything. There was a lot of ego there. And, I was in the medical model, but I had headaches. And so, well, I'll give it a try. It doesn't look like it's going to hurt anything. And I'm going to probably be okay. And I'll still have my headaches afterwards. And then I started getting treatment and my headaches started going away. And my sinuses started to open up really well. And I was hooked, and I started looking at it a little further and got into it. And I started looking at my patients who had TMJ problems. They had headaches and neck aches. And I said, gee, maybe this can be incorporated into what I do as a periodontist for the people who have these typical problems. And it did. This type of therapy really accelerated the healing. People got better faster, and it was kind of a great thing. And we just took off from there. And that was around the late 70s, 1980. And then I started just getting into the fascia work, the connective tissue work. And then I found that was really good for children who had asthma especially. And what I did was I worked on my first asthma child, and he got better, and I wasn't even sure why it even got better. But as I saw a number of asthma kids over series of years, I discovered that asthma, or pediatric asthma, was a disease of tightness in the fascia of the respiratory system. Somewhere in their diaphragm, somewhere in their lungs, somewhere in their tracheobronchial tree, somewhere in their throat and their nasal pharyngeal sinuses, they're tight. There was some type of trauma and their bodies got tight and their respiratory system didn't work that well. And that was really an eye-opener for me. And then later on in 2003, I was invited to join the Family Hope Center, which is a brain injured center. And I found out a lot of those children, the children with cerebral palsy, epilepsy, the brain injured type of autism, they had a lot of pressure around their brain. Their brain really couldn't expand and contract like a normal brain would. It was a big part of their problem. And in 2006, we were introduced into the Amish and Mennonite communities in Lancaster, where they were interested in working on their babies. And we saw over 6 years, we saw about 500 or 600 babies there, and we worked on them. And that's where the discoveries came. And we went to Mexico, and we worked on about 80 or 100 babies in Mexico, where we trained about 16 doctors. And as we train around the country, we're working on babies, and we found that what we do is pretty unique. It's universal. And since then we've trained people in the United Kingdom and in South Africa, and we found out that the therapy works in the United Kingdom, it works in South Africa, it works for the babies. So pretty much, Stefan, that this is a universal message that babies are tight. And what we see at least with the babies, is their soft tissue trauma during those 40 weeks. Something happens during delivery. There may be a vacuum suction, there may be a forceps, there may be an umbilical cord wrapped around the body or around the throat. There may be shoulder dystocia. Something happened in the labor. There may have been a long labor. There may have been a lot of pressure in the labor. There may have something happened in utero where the baby got stuck, the fetus got stuck. They got stuck in a position that the fascia got tight and twisted. And it was okay when you're in utero, but when you're born, it doesn't work. It creates a lot of strain in the body. And basically, the bottom line of what we do with infants is that because of this trauma and the soft tissue strain, your baby's born tight. And that's what we see at birth.
So even if you have a surgical delivery via C-section, you can end up having a tight baby who needs to have this craniosacral fascial therapy to help them.
Right. There could be a lot of pressure in utero. There could be a lot of tightness in there. Maybe you got stuck. Maybe there were fibroids in there. Maybe the cord was wrapped. Maybe your mother's uterus was tight. You couldn't expand or contract. Things are just generally tight in the area, and it creates a problem. When we were with the Amish and the Mennonites, most of the babies had home birth. They had home deliveries. And very few were in the hospital, but the babies that were born in hospitals, they still had the tightness. They had the plagiocephaly, they had the torticollis, they had the twisted heads, and they had all the fuzziness issues. And so it was kind of unexpected. We thought most of the problems would be during delivery and during labor, but we found quite a few of the babies had problems in the fetal experience. Somehow they got stuck and they got tight.
Gotcha. And so my baby, who's now 7 months old, he was a breech baby, and we were going to try and have him born vaginally at home with the only doctor in the area that does vaginal breech at-home deliveries.
Wow.
He was, out of network, obviously, and considered kind of anathema by the traditional medical establishment. But this doctor was amazing, and he got incredible outcomes for the babies and so forth. Problem was, our baby did not descend, and so my wife's going through labor and labor and labor, and he's not descending, so she was fully dilated, and the bag doesn't break, the water doesn't break, he doesn't descend, and so eventually we have to go to the hospital and get a C-section.
I understand.
Which was not fun. Not fun,
right.
Especially when you've invested so much in having a calm, beautiful, at-home delivery, and it all that planning and preparation right out the window. We went through the hypnobabies training so that she could use hypnosis instead of using drugs.
Right.
And boy, we were so prepared. All of it for naught. It's very
Right.
frustrating. Yeah. And,
I'm
and
hearing the same story that my wife and I went through in 1973 when we had our first. At that time, we did Lamaze, natural birth, breathing, the whole 9 yards, went to the hospital, and it just didn't happen. Our first was breech. Doctor said your baby may get caught in there and the head, with all the breech issues. So my wife ended up having a C-section reluctantly. And, with the same story, just have to go with it and do the best you can.
yeah, yeah. But now we have an amazing, beautiful, happy, just super smart baby. We're very, very blessed.
That's great.
Um, yeah. And what brought us to find out about and to have exposure to and actual experience with CFT or craniosacral fascial therapy with our little one was the plagiocephaly. So for those listeners who don't know what that is, that's flathead syndrome. When the Back to Sleep campaign was really out and in the media, and still a very important part of SIDS prevention. But one of the side effects of this is babies end up having a very flat head in the back because they're sleeping only on their backs. And so our little one was getting that, and CFT seemed to be a potential treatment for that. So before we kind of go too deep into babies and stuff, I want to make sure that our listeners understand that this is not just for babies. CFT is for everybody. I've had CFT treatments myself. My wife has had as well. And as you said, Dr. Gillespie, that was transformational. What you got in the early days of before you even developed this whole Gillespie approach, you had these headaches that went away because of the craniosacral approach that you had tried. So, but let's talk a bit more about the adult-related issues, and we'll come back to babies later. Let's specifically jump into issues with like TMJ and what that means, and things like clenching. And I do this at night. I clench and grind at night. I wear retainer for because I had braces like 10 years ago, and I still wear a retainer to make sure that my teeth don't go back into wonky places. So that kind of promotes the grinding and clenching. So I'm curious to hear more about CFT and those sorts of scenarios.
Yeah, the typical adult comes to me, Stefan, with pain. And they usually have a headache. They could have a migraine. They could have a cluster headache. They could have a tension headache. They could have a TMJ headache where their jaws are tight, their bite may be misaligned. There may be some strain in their jaw. A lot of people come with neck aches, so they have upper back aches, or they have a shoulder pain, or they have a mid back tightness, or low back, or their knee, or there's some place in their body is there's some pain somewhere.
Mm-hmm.
And usually this come in and it's pretty chronic. It's been there for a number of years, and usually sometimes they can trace it back to an accident. Yeah, I had a car accident, or I got whiplash, or I had a bad fall, and then started from then. And a lot of people don't have a real reason, and you go back into their history and they said, yeah, I used to have headaches in high school and junior high and in sixth grade. And as soon as I hear that, I'm thinking birth trauma. You've probably had it your whole life. There's been strain in your body, and now you're 42 years old and you have headaches, and we're going to try to work that strain out of your body where the connective tissue or the fascia is tight in your body, and it creates restriction around the free nerve endings. And those nerve endings, if things aren't happy around them, can become tight, and you can develop pain. And that's where people have pain. And I can almost say that there's a strong possibility that any listener to this right now, if you have pain anywhere in your body, whether it's your head, your neck, your trunk, your appendages, anywhere, that there's probably a fascial component. There's tight fascia in that area putting pressure on nerves, which is creating some of that pain.
So let's distinguish this for our listener, because they probably know that they should get massages and they might have tight muscles, but the fascia and the relationship with the muscles and with the joints and all that, that's very important to understand, because if they're addressing just the musculature without addressing the fascia, they're not solving the problem.
Exactly. You're in half the equation. I know massage therapist, which I am, I'm part of the equation. The muscle work is great. A lot of people get muscle work, but it really doesn't address the fascial strain in the tissue. And just to go a little bit into histology, if you take a muscle cell, which is about the size of a hair, and if you realize that there's a fascial layering like saran wrap around each muscle cell, and you put a number of muscle cells together into a bundle, and there's another fascial layering around that, and you take a whole muscle and there's another fascial layer around that. If you people talk about muscles, and I'll talk about, well, there's part of it's muscular tissue and the other part is fascial tissue. And that fascial tissue can get strained in an accident. And yes, if you have massage, that strain will be, that the muscles will respond nicely, but you'll probably have that fascial strain that's with you, and you need to have that fascia addressed.
And it doesn't just go away on its own. If you
Usually
have
it
some,
doesn't. Sometimes I've thought about it, and if the trauma is not too severe, it may go. The body may heal it on its own. But if you've had a blow to the head, if you've had a concussion, if you had a sports injury, if you have old football injuries, if you were a cheerleader and you fell, or if you've had car accidents, you fell down any type like this, that fascial strain is probably going to be imprinted into your fascial web. And that needs to be looked at and to addressed and to released in therapy.
right, because if you get one part of your fascia being tight and kind of not letting go, right, you are going to end up with pains in other parts of your body because it is disrupting the web of that fascial network.
Exactly. And your TMJ, your headache, may be starting in your back or your low back or your pelvic area. And we hear those as mothers and said, yeah, I didn't never had headaches until I had my first child, when there was a lot of pelvic trauma and the sacral part of the craniosacral got tight. And over a period of time, it's like a web that just it's like a grapevine that just goes all the way up into the back, into the head, and everything gets tight. And I started developing headaches and eye problems, and I have fogginess, and I can't think that well, and everything in your body gets tight. Basically, Stefan, I see tight people. And if
Right.
you have a brain, if you have fascia, you can get tight. And tightness is cumulative. It kind of doesn't go away, and it builds up over a period of time. And when you become older, things get tighter and you get more pain, and that's part of the whole craniosacral fascial system. It's just getting bound down, it's just getting tight, and you need therapy to help free it up.
Gotcha. And how many therapy sessions would be typical? Is this something where in one or two sessions it can be solved, or is this something where you need ongoing therapy sessions, like you go in for a massage every couple weeks and you do that forever because you keep uh, straining your muscles and you end up needing that?
Usually it's a series of visits, Stefan, and usually in the first visit, I usually set it an hour aside where you do an evaluation, we do a treatment, and I'll do a treatment for an adult or a child or an infant. And people will see what it's like, and afterwards they'll say, gee, I feel a little bit lighter, a little bit looser, I feel a little bit better. And then they decide, yeah, I'll continue, or I don't want to continue. But usually it takes a series of visits. And the thing is, what we're dealing with is getting to the cause of the problem, getting to the root of the problem. And I tell my students it's a terrible business, because most medical people are in their management business, where they'll manage the problem, they'll manage the headaches with medications or drugs, and You keep taking the drugs basically for the rest of your life. It's a nice business, and but what we do is try to get to the cause of the problem, to get to the root of the problem. And once you're corrected, you're pretty much done. So we usually don't see people too much afterwards unless you've had another accident, or if the child's had a sports injury, or the baby has had some type of trauma. But that's usually the way it goes. There's really no checkup visits. And by that time, the person or the parent really knows that if there's a trauma for my child or myself or my baby, we'll go back for checkup visits, but otherwise it's not really ongoing, so to speak.
Yeah, there's no recurring revenue model there.
No, it's terrible. It's great for healing. If you're interested in healing, it's all about healing, which is great, but it's not a great business model.
Gotcha. Yeah, that's funny. Okay, so let's say that somebody has an issue with lower back pain. How would you determine where this is, what the source is? Maybe it's coming from a tweaked shoulder and the fascia is tied up there. Maybe it's TMJ issues with the jaw. Like, how do you diagnose where the issue is originating from?
I can't really say on that first visit, Stefan, because I'm not sure where it's originating. I can't really tell. And I can only really tell is when I call it the onion, we've peeled a lot of layers and now we're down to the core and see what's left. And you might say, well, the TMJ is the last thing that's left, or the neck is, or whatever, my shoulder or my lower back is the last thing that's left. So I know we're into the core issue. That was probably where it started, and that's where it's going to end. So it's really hard because everything's connected. And a person might come in with a jaw problem, and then they'll say, well, my jaw feels better, but my neck's starting to hurt. And after another visit or two, the neck's starting to clear out, but my back's bothering me. And then the back clears out, and then it's my low back's bothering me. And I have to explain this along as you go along in therapy, so that the patient understands how it all works. You're going in and you're trying to get authentic healing. You're trying to release all of the strain in the body that's presenting itself. And a lot of times that people will have things that'll happen to them or their child, like they'll never even mention, like they'll be bedwetters, and the mother won't even mention it on the intake, and the child will say, well, the mother said the bedwetting stopped. And I said, yeah, there's a lot of strain down there in the pelvis, down near the, that area of the body. And once it released, the bedwetting went away.
Amazing. Yeah. So there are a lot of seemingly disconnected issues, but you get to the root cause, as you said, and they all go away.
Yeah, if you're looking at the typical medical model, I mean, which is good. We need doctors, we need specialists. There's a specialist basically for everything. There's an ophthalmologist, there's an ENT, there's a dentist, there's a specialist for every part of the body. Well, we really don't look at it like that. And we're in the fascial web. All these organs, all these organ systems are all connected. You can't separate them.
Right. It's like aspen trees. They're all connected on the root system.
Yeah, it's like an energy field, and it's all connected. And we do well with acupuncture people who are getting fascial work, and they're getting the meridians opened up, and basically we think that's a lot of fascia is releasing, and they're opening up the energy flow of the meridians. But it's all connected, and it's this huge fascial web that's everything's connected to, and nobody's really looking at it.
Interesting. Now I've had some exposure to another type, or maybe it's related type of therapy, and it goes by several different names, like fascial counter strain therapy, or strain counter strain,
right?
Or there's probably another name too that I'm not thinking of. But
yeah, there's myofascial release, which people are familiar with.
Yep. Yeah. So how does that compare to your approach to the Gillespie?
It's very similar. It's the biggest approach is myofascial release, which is John Barnes, physical therapist, has trained over 100,000 therapists in America about this therapy. And if most of the listeners may be familiar with myofascial release. And what I did, I I studied with John, but way back in the 80s, and I worked in his office for a number of years, and we're very close. And what I found out, I said, gee, if you connect this craniosacral work, which I learned from the cranial osteopaths and Dr. Fryman back in the 70s, early 80s, and if you connect that with this whole fascial web, and you start including all of the TMJ and the oral pharyngeal work that I learned in periodontal and dental school, if you put all those together, you're going to come up with something really great. And that's how we came up with craniosacral fascial therapy.
Mm.
You're addressing the craniosacral, the brain motion, you're addressing the fascial web, the tightness, and you're addressing a lot of the oral and the pharyngeal work, which nobody really goes to in dentistry and TMJ. And, that's how it all got started.
Interesting. Now, I had it was Tim Hodges, who I've actually had on this podcast, very early episode, and he's a practitioner in fascial counterstrain. He worked a lot on my head, on the like, I don't know. It's hard to describe it. He just worked on the top of my head, and it affected different other parts of my body, which I guess was because of the connection with the fascia.
Right.
But is that a pretty common thing that seemed kind of like voodoo? I mean, it worked if I felt better, but it was kind of unheard of up until that point where I'd never been exposed to anything where you do some manipulation to the top of somebody's head and then it affects all these different parts of their body.
Right. It's all connected. Like you can have a fascial strain in the trunk. The problem could be starting down there in the pelvis or the low back, and it can be pulling up into the cranium. And if you start with the cranium, that may start to release, but that fascial web will lead you as the therapist down into the back and the low back. So you'll have to address that also. It's a
Mm-hmm.
full body approach. It's just not a segmented
Gotcha.
approach.
Yeah.
So the strain counter strain it's very similar, and we're all like siblings, and we
Yep.
all have a piece of the puzzle. We try to incorporate the whole body, and when we work with children and especially with infants, you've got a send of pounder, you can get the whole body going and everything can start to open up and release at the same time.
Mm-hmm. Gotcha. And then there's something else I had heard of, but I haven't experienced. Somebody recommended it. It's I think called Atlas therapy. It's an adjustment of that first cervical vertebra. It's a
Right.
one-time thing, and for many of us, apparently, our atlas is misaligned. Just takes one adjustment, and then you're done.
Right. Yeah,
Have
I'm
you heard
familiar
about
with that
this?
therapy, and
Yeah.
I think it can be very effective. And I do send some people out for that type of therapy for chiropractic. The babies who have torticollis, who have twisting in their neck, sometimes the adults have twisting in their neck, and they may have a head tilt where their head is still tilting to one side. I definitely have them send them out to osteopathic or chiropractic where they have C1 and the other cervical vertebra checked. But the thing is that if you're doing that type of therapy, which is all great, you want to make sure the fascial strain around C1 is gone. You want to make sure the fascial strain around the cervical vertebra are gone. You want that twist worked out of that cervical vertebra so that once the C1 is in position, it will hold that position. The fascia isn't going to twist it back into the original position. Otherwise, you'll be going back for visit after visit after visit, which is not what was intended. So there again, the fascia has another situation here where it's part of chiropractic, where the spine will hold its position as long as the fascial web is pretty happy.
Mm-hmm. And how does this relate to scoliosis?
It rates the scoliosis in that the muscles and the fascia will act on the spine and actually twist the spine. When I was 33, I started getting back problems and neck issues, and I went to the chiropractor, and he said, "Oh, you have scoliosis, and you're 33, you're done. You can't do anything about it." Well, I'm the kind of person that if you tell me something can't be done, and it's impossible. I will look into it and I'll find a way. And what I found was that the muscles and the fascia have a great effect on scoliosis. And so I had a lot of muscle work, and I had some people work on my fascia. And it took a while. It took a number of years because I was so late in life. But my scoliosis, I'm 73 now, and my scoliosis is gone. And so it's kind of nice. You don't, when you're 32, you never think about when you're going to be in your 70s, but you want to be feeling pretty good. And so it's kind of a nice thing. And we wondered if scoliosis started with difficult birth. When we saw the babies, when we worked on their backs, there's a lot of twisting and pulling and turning in there. And if you see this over a number of visits with babies, I said, is this what scoliosis is? If you leave this untreated, is this what creates scoliosis and kyphosis and lordosis? You know, back problems. People have back problems their whole life because it wasn't addressed at birth.
And so, is there science to show that that's the case, or is that just a hypothesis?
There is no science. It's
Okay.
just what I've seen over 40 years.
Right.
You know, I've seen over 1,000 babies, probably given over 10,000 baby treatments, and it's just what I've seen. There's no medical, hospital, scientific, randomized controlled, double-blinded research to anything what we do. And
Yeah.
that's just the way it is. That's the way the medical model is. But when you see it, you know, after 100 babies and after you see it for 40 something years and it works, it works. That's what got me interested in the work. My headache went away. I see it work patient after patient. So the whole thing works.
Yeah. Very, very exciting. And what an amazing outcome for you to not have scoliosis now and not have the headaches and so forth.
Right.
That's great.
Right.
Now,
If I'd been a periodontist, I probably would have been retired when I was 60 and still had headaches, a lot of medication and scoliosis, and would have been a different story. But you know, here I am, so I'm happy.
yeah, and all the people that you've touched, all the babies who've grown up and are
I know,
happy and
growing up.
healthy now.
We've had
Yeah.
teachers and we've had over 1,000 students, and they're out doing the work. So it's very exciting.
How many are certified, like
We
Gillespie
really
approach?
don't have certification. We just teach people because a lot of people that come to my seminars are mothers. They have a child who has an issue and they live not near Philadelphia, and so they take the training and they have 3 or 4 children who all need therapy. So we have mothers who take the therapy, and we have a lot of different. It's a very eclectic group. We have physicians, dentists, chiropractors, osteopaths, all types of therapists. So basically, we have. There's really difficult to certify people. We just train people, and they go out and just do the work according to their licensure.
Gotcha. Okay. Now you mentioned that children who had asthma were positively affected through this treatment. Did you find that adults with asthma could also be positively impacted through this?
Somewhat, but there was a window of opportunity with the children. It's because when you're 5, 6, 7 years old, the histology of the respiratory tissue doesn't change. When you become an adult and you've had it for 30 or 20 or 30 years, then the histology of the lungs changes, and you can get a result, but you're probably not going to get 100%. But you can get enough where it's something to look into.
Right. So it does. It can positively impact your quality of life,
Right.
even if you're older. Got it.
Even if you're older, yeah.
Okay. Now you mentioned autism.
Autism. We've seen that with at the Family Hope Center. We've seen the children who are autistic, and one of their aspects is that there's a lot of pressure in their head, and their brains aren't normally expanding and contracting. Their craniosacral is very, very tight, and their brain isn't just not expanding and contracting. So it takes a number of visits before the pressure in their neck. There's going to be a lot of fascial strain in the neck and the head, and we can usually see it in over 3 or 4 visits, and we start to get a brain cycle. That's a piece of the autistic spectrum correction. It's not totally corrective. It's helpful for some. Occasionally, over 40 years, I've gotten 1 or 2 babies, children who There was something happened where they came in for therapy and their autism went away. That story went on the internet, and all of a sudden I got these calls, and I had to tell people that that's the rare exception. Usually, most people need children need a number of visits, and it's going to take other things to do.
Right. So, like I had learned, for example, that there's a connection to the gut and gut health for autistic children, and they usually have gut problems. And I recently interviewed Dr. William Davis, author of the book Wheat Belly. We talked about this on the
Right.
episode.
Right, the microbiome and the gut is actually the second brain, actually. So it's there's a connection in our work with the fascial web of the microbiome. You see these babies who are constipated, these children who are constipated, or they have bowel issues. Their fascia is tight in their intestinal area. They're just tight.
Yeah. Yeah, I remember having severe um problems with my gut and with constipation when I was really little. And thankfully it went away, but that it was serious. It was really, really serious. And back then, parents and grandparents, I was living with my grandparents, they didn't know what to do. And they just didn't do anything really.
Right,
Uh,
nobody knew. And right now, what we're saying is that the fascia that connects the tissue in your trunk and your lower body and your abdominal cavity is tight around the intestines. And intestines need something that's called peristalsis, which is like a wave-like motion to keep the fecal matter going and keep it going so you could expel it. And we believe that the fascia gets tight in the small intestine, large intestine, and this peristalsis decreases and everything kind of gets stuck there. And when it gets stuck there, you get constipated. And we see that with the babies where the mother will come in and the mother will say, well, my baby goes to the bathroom every 5 days. The pediatrician said it was fine. You're breastfeeding and 5 days is fine. In our world, it's not. You need to go every day, at least every other day. The fascia is tight in there.
yeah. Yeah, it's kind of like what's it called, the jet stream. If that stops working, then like countries like the UK get really cold and so forth. So that movement it keeps everything working, and when it
Right,
doesn't work, you got big problems.
right.
Now, one thing that I'm just making in a connection while we're speaking, I remember my mother telling me this. She's passed away, but she had told me multiple times how hard her labor was with me. That she was in a very long labor of, I think, 48 hours or something like
Wow.
that.
That's a
Very,
long
very,
labor. The
very
average
long.
labor is like 7, 8 hours in America. So,
Yeah. So this was well over a day long that she was laboring, and she did have me vaginally, but it was I just wouldn't come out. So I'm curious if there's a connection there to, in terms of potential traumatic birth, and like I have really extreme tightness in my shoulders, in my neck. My neck is forward. I spend a lot of time on the computer, and that doesn't help for sure. But I have a real problem with my neck and head being too far forward. I'm curious if that that long labor that my mother had contributed to a traumatic issue with my fascia.
it probably did. And it's probably predisposed you since it wasn't addressed at birth and nobody did anything and you grew up with it and here you are. And it's kind of thing that in my perfect world, if I was there at your birth or one of our students, we would have checked you, Stefan, when you were 10 minutes old, right after that 5-minute APGAR score, and you were good to go with the APGAR. We would have said, hey, mom, let's just see if Stefan, you probably wouldn't have a name by then, just to see if your baby's tight. And we would have found that you were tight, and we wouldn't have put a label on it because you're only 10 minutes old, so we're not going to give you a disease. We're not going to say there's a nursing issue or you have whatever you have, torticollis or tightness. but we're just going to say you're tight, and we're going to work out the strain in that first 10 minutes, and you're going to get your first treatment. And in my world, you're going to get your next treatment the next hour, and then the next hour, and by the time you're going to be at the hospital for 24 hours. So the nurses are there, the therapists are going to be there, so somebody's going to be checking you every hour. So by the time when you leave, Stefan, when you would have left the hospital on the second day, at the end of the second day, you would have been really loose. You would have been calm and relaxed. You would have been breathing well, nursing well, digesting well, pooping well, and napping well. You should have been a pretty happy baby. But that's not the way it is in the world today, and that's what we want. That's the ultimate goal, is to have birthing people check you when you're minutes old, to reverse that trauma that you've had in 40 weeks. And yes, if your mother came in with you and said, "Hey, this for Stefan, I had a 48-hour labor," that's a huge red flag. You know, we don't have to check you. We just, well, let's just go into therapy and see what's here, and you're going to be tight. So maybe that neck issue, that shoulder issue, and was because you were tight at birth and nobody corrected it.
But it's never too late, right? So
It's
I can
never too late.
still get some some relief. Okay.
Sure. That's just how we see the world. Everybody sees the world differently, but since I'm in the work, I see it as fascial web. And what happened to your fascial web? And what about all those traumas when you were a kid and the sports injuries and you fell off your bike and fell out of the tree and fell down the stairs, and all that stuff's inside of you, and that makes you just a little bit tighter. And so that stuff needs to be worked through too.
Yeah. I remember I was in 3rd or 4th grade and I was pushing one of those metal merry-go-rounds.
Sure.
Really, really fast. I was really trying to get that thing spinning fast, and then I slipped and fell and hit my head. I think it's like the right temple, and it was just a bloody mess. Right above my eyebrow, and I don't recall if I had to get stitches. I don't think I did get stitches, but there's still a scar there, and I'm sure that was a pretty traumatic thing to my biology and musculature and fascia and all that too.
Right. Right, and I'm sure your mother took you to the hospital. You went to the emergency room, which you definitely should have done. You should go to the doctor and get checked and get the stitches and whatever medically you need. But that final step before they leave, you leave the hospital, hey, let's check your brain motion. Let's check your craniosacral. Let's make sure your brain's moving nicely. And in most stories, most hospitals, that's not done. Or in most medical offices, and you leave with a really, really tight head. And then you wonder why you have headaches and you have cognitive issues and you have reading issues and you have problems at school and you get tired a lot and your head's tight. Your brain can't function like it normally should.
Right. And where does chiropractic and massage therapy fit in with this? Are those things that you would recommend adding to the mix here? Is that sometimes not really necessary if you address the fascial issues? And is it something that you'd want to do on an ongoing basis, like go to a chiropractor?
Chiropractic and osteopathic manipulation and massage are very complementary, along with acupuncture, any type of energy work. Things that we're trying to find out where the strain is in the body, what's tight, and we're realizing the body can heal itself. And we're just trying to help the body free itself up. So yes, all these can be very complementary.
Yeah. So do you, for example, go to a chiropractor?
I don't. I work with a chiropractor in the office, but I don't. I usually get this type of work and I get massage work, and that usually helps me out if I need a problem.
Okay.
But I'm not against it. And chiropractic can be very helpful, especially if there's a neck issue. And craniosacral fascial therapy is worked out all the strain, but the vertebrae just aren't lined up. And usually after CFT with an infant, you want to go to an osteopath or a chiropractor to make sure all the vertebrae are in where they should be.
Yeah. Gotcha. Now there's a particular type of chiropractic. It's not even chiropractic. It's more like energy work. It's called network
Right.
chiropractic, founded by Donnie Epstein, who is an amazing human, and he was also a guest on this podcast. I'm curious what your familiarity is with network.
We don't have that much around in Philadelphia. I don't see too many network chiropractic patients, so I can't really speak about that.
Okay.
But I can be very positive about the whole experience.
Yeah.
I'm sure it's very complimentary.
Yeah, I've had multiple entrainments. That's what they're called. These energetic kind of adjustments, and yeah, transformational. Really
Sure.
transformational. Not just physically, but spiritually. Even I've had some profound spiritual experiences
Hmm.
through entrainments. Anyway,
Sure.
so you mentioned acupuncture. Are you somebody who goes to get acupuncture treatments or acupressure or anything like that?
I don't, but a number of the people who come to me do. And
Hmm.
the chiropractors like to send patients to me because it frees up their brain. It frees up the brain motion, which increases the chi, the energy. It releases the meridians around the body. So the acupuncturists seem to get a better result when the fascial web is a lot looser, it's a lot freer.
Okay. Now you mentioned the brain motion. Is there some sort of APGAR test or anything for brain motion? Some sort of
There is. I
numerical
created
score?
a baby brain score where, in part of the where when you're born, we'll check your brain motion. And
Mm.
your brain motion wants to be where your brain is fully expanding at least 50 seconds and fully contracting at least 50 seconds, where this total brain cycle is at least 100 seconds, where the brain is open, the brain's relaxed, the brain is moving nicely, the cerebrospinal fluid is flowing nicely. This is what we want. Sometimes the children are born very tight, where there's a lot of pressure in their heads, there's no expansion, there's no contraction, and they
Okay.
have 0 second brain cycle. That doesn't mean they're a vegetative child or a vegetative baby. They're not comatose. It
Hmm.
just means that there's a lot of tightness, there's a lot of pressure around the brain. And once you open it up, the brain will work better.
See, I didn't realize that a baby's brain kind of pulsates like that
It
with the
pulsates, it
cycle.
expands and contracts, and it's very, very important for the neurology. And what I found over 40 years is that most babies work on when they go when they're around 3 years old. They're usually pretty smart. They'll start doing things that most 3-year-olds aren't. And by the time they go to school, they're too smart for school.
Mm.
They need to be in some special class. They're bored with school. You'll end up with hopefully smart kids. That's what we found. Again, no scientific research on that, but that's what we've seen over 40 years.
Gotcha. And are earaches also correlated with?
Earaches, yeah, we see the children who have earaches where the bones are out of alignment and they're tight, the ear bones, and that creates a misalignment in there, and the fascia is tight. And once we release that, a lot of times the earaches will get a lot better. And if they don't, what we found with the earache kids that mucus forming foods, the dairy foods are a problem. The
Mm.
pizza, the ice cream, the dairy issue, the dairy problems, dairy products are a problem with earaches. The child needs to clear out of the dairy.
So how do you tell that how can you diagnose when that's an
We
issue
don't
that
really,
like?
I can't really diagnose anything, but usually I'll tell the mother with the child with earaches, I say, look, half of the children are going to get better with this therapy, the other half aren't. I don't know which half are going to get better. And so if your child gets better with the earaches, but there's not total 100% clear out, then you have to look at the mucus forming foods. The number one food are dairy foods.
Gotcha. And so you do like an elimination diet and
Yeah,
then.
yeah, I can't tell the mothers what to do. I don't tell any parent what to do, but I strongly suggest that. It's interesting when we did our Amish research, we saw maybe 500 or 600 babies, and almost all the babies did well, and some of the babies still had sinus issues and they had intestinal issues, and we felt that the dairy was a problem.
Mm.
So try telling an Amish mother who runs a dairy farm
Hmm.
that her baby shouldn't have dairy in the breast milk. So the mother had to get off dairy, and some of the mothers did get off dairy, and the babies did fine. The others didn't. So you only do what you can. You only do what you can do.
Right. Right. So you're just asking for them to make some behavior changes, and hopefully that
Right.
that
Right.
that that happens, and then there's a positive outcome.
Yeah,
So
and I'm a therapist, so I can't diagnose anything. I can't tell people what to do, but I make suggestions or
right.
recommendations, and people do what they want to do anyway.
Right. Gotcha.
So
Okay. Now, what if somebody wants to go to get some CFT or get their baby checked? Is there a website or network of practitioners trained in CFT that you can look up in a directory or anything?
we do have a website. It's gillespieapproach.com, but I don't have a directory on there because of legal liability reasons.
Okay.
But you can go to our Facebook group, Gillespie Approach Facebook group. And if you go on there and say, hey, I live in Salt Lake City, or I live in Houston, or I live in wherever, St. Louis, is there anybody near me? Then probably somebody will come up and say, yeah, I'm down the road. And, if not, you can Google craniosacral fascia or develop, craniosacral or fascia, myofascia, any type of that, and your where you're from, your zip code, and people will come up around you. But generally speaking, if you're in pain, you want to think about fascia, fascial tightness, fascial restriction as at least part of your correction.
Yeah. Yeah. And if you're in LA like I am, you could go see Lauren Brim, who is awesome. But yeah, there are. I strongly encourage our listener to go sign up for that Facebook group and ask the community how many people are in that Facebook group.
There are 2,900 people in there now.
Oh, that's pretty good.
So we
Nice.
did pretty well. We started in 2011. One of my teachers, Kim Sherlock and Holly Steflik, they told me gee, Barry, you ought to start this Facebook group in 2011. And, I had no idea what Facebook was, but so it's grown since then. So I'm really excited about it.
That's awesome. Okay. Well, this was wonderful. Thank you so much, Dr. Gillespie. Again, listener, go to gillespieapproach.com to learn more, to potentially end up going to the Facebook group then and find a practitioner. And who knows, maybe get some lifetime benefits from this approach and this therapy. Thank you again. We'll catch you on the next episode of Get Yourself Optimized. I'm your host, Stefan Spencer, signing off.